Hello, my name is Benjamin Nguyen. I'm a student nurse here at the College of Nursing. Today I'll be performing my Enema Checkoff. I'm going to scan the room. All right. So the first thing I'm going to do is verify the hospital policy, the order. I'm going to identify my patient using at least two identifiers on the MR and the wristband. So it's Jaguar J. Jones, date of birth 08/25/1963. MR number is 4176352. Matches up on the wristband, so we're good. I'm also going to assess for allergy. So I see here he's allergic to penicillin. So after I do that, I'm going to gather all of my equipment, which I already have here off to the side. I'm going to perform hand hygiene, don my goggles, and my gloves. I know it doesn't say anything about gloves on the checkoff, but I will wear mine. So move you guys over here. So I'm going to clamp the tubing onto my bag. We'll just clamp the tubing. I'm going to add 750 to 1,000 milliliters of water. I'm going to add soap and then gently agitate. I'm going to place it down onto a firm surface, not on the patient's bed. If I had an IV pole, I would hang it on there. I'm going to lower the bed to a good working height, lower the side rail, position my patient in the left lateral sims. I'm going to place my mat under my patient. I'm going to grab the tube with my dominant hand. I would lubricate with my non-dominant hand. I'm going to touch the patient's hip, tell him, just take deep breaths during the procedure. So I'm going to take my non-dominant hand, spread open the rectum, insert the tube about 3 to 4 inches. If the patient has hemorrhoids, well then the patient may bear down to facilitate the process. So once that's in there, you're going to make sure you're going to be holding the tube during the entire time. You're going to unclamp the tubing, and you are going to remove the bag from the IV pole. So make sure that it is 12 to 18 inches above the patient. If there's any cramping or discomfort during this procedure, clamp the bag or either lower the solution. Instruct the patient to take deep breaths. So after you do that, once the solution is instilled, you're going to clamp the tube. You're going to pull out. You're going to dispose of that. Dispose of the mat. You're going to position the patient. You're going to position the bedpan. So this is how I'm going to do it in relation to the patient. You should have had this bedpan on you nearby at all times. So after that, I'm going to remove my gloves and goggles, perform hand hygiene. Then I would go document the procedure. I would document the amount and type of enema. I would document the patient's tolerance to the procedure, and I would also document the color and amount of return. And also, earlier I forgot to mention, after removing the tube, you would allow your patient to hold the enema for 10 to 15 minutes.